So let's start here. Muscles that move the shoulder girdle. Remember, shoulder girdle, we're talking specifically about the scapula. Okay? How does the scapula move? The shoulder joint, which we'll talk about in the next section, that's how your humerus moves. But in this section here, we'll get all the muscles that move the scapula, your shoulder blades. These pictures here are going to show those 6 different actions. Okay? Elevation and depression. Okay? Those are opposites. Elevation is shrugging your shoulders up. Depression is returning from a shrug down. So if I've got my scapula here, okay, elevation, scapula comes up, depression goes down. Next two here, upward and downward rotation. And what I want you to focus on is we're going to look at the glenoid cavity or the glenoid fossa. If that turns up, that's upward rotation. And that occurs when you lift your arms above your head. What happens is that scapula there turns up. So when the glenoid cavity turns the face up, that's upward rotation. And the exact opposite would be downward rotation. The last two, that we're going to define as protraction and retraction. Protraction, okay, is coming forward like you're a boxer and you're jabbing someone. So protract, boom, punch, you're jabbing. And basically what happens with your shoulder blade there is it comes forward like this. Okay. Comes around and comes forward. Other way is retraction, that's bringing your shoulder blades together. So if anybody's talking about having good posture, retraction, bring your shoulder blades together. And this video here might make a little bit more sense. Alright, so that's elevation there. So notice how the shoulder blades start down and they come up. That's going to be elevation. Coming back down, that's depression. Scapular depression coming down. Upward rotation, notice, as the arms are lifting above the head. Okay. The glenoid cavity points up. And then coming back down, that's downward rotation. So that glenoid cavity here is coming from an up position. Coming down. This one, protraction. Notice, okay, that shoulder blade is moving forward around the rib cage. And if you look really closely at this video, which you can do on your own, okay, when you do that, there's abduction and lateral rotation. And the scapula tends to point downward. So essentially, protraction is a combination of 3 different movements. But for our purposes, we're going to keep it simple. Protraction, we're thinking scapula moves forward. And retraction, shoulder blades move backwards, kind of like you're pinching a penny between your shoulder blades. It's coming together. So retraction, coming together with. Any questions about those actions? Letter B. Now what everybody should have picked up there in the back is a packet. And this packet includes all of the muscles we're talking about in all of the units and all of their actions. So make sure you grab one of those. So if you notice the top one, I apologize, it was stapled funky. The top one there, that one we've already gone through. The muscles that move your axial skeleton. But if you turn to the back side of that front page, that should show all the muscles that we're going to talk about and their actions, talking specifically about the shoulder girdle. In your notebook, it's got it organized differently. It has the action and all the muscles that perform that action. So what I provided here is just a different way to organize it. Feel free to use both when you're studying the muscles and what actions they perform. But I would have this handy here as we go through the muscles here up on the board. Start here with the trapezius. Trapezius. Okay? Any math geniuses in here? We're thinking trapezoid. Trapezoid is a kind of a four-sided figure. And this is the left trapezius, but you've also got one on the right as well, and it kind of makes like a kite shape. Makes a kite shape there. Now, you will not need to know origins and insertion for this one. But what you will notice with the trapezius, we've got three different parts. We've got an upper, a middle, and a lower. And based off of where these muscle fibers run, remember muscles can only pull, we're going to determine what movements happen at the scapula. Notice that all of these fibers here are attached somewhere on the spine, and going to attach somewhere on the scapula, specifically along the spine of your scapula. Take a look at the red part, the upper trapezius. Notice these fibers are coming up. So one of the actions of the upper trapezius is elevation. So trapezius helps with elevation of the scapula. In addition, notice here, it attaches along the spine close to the acromion process. And so if I pull up at this point, I'm pulling up, it's going to also help with upward rotation. So elevation and upward rotation. In purple, the lower trapezius, it does the opposite in some cases. So instead of pulling up on the scapula, it pulls it down. So this is going to help with scapular depression. However, it does also help with upward rotation. So that's different. You would think it'd be opposite, but it's not the case. Basically, these fibers, okay, it's going to help with depression, but also they're going to pull, okay, the border more like this. So the lower trapezius is also going to help with upward rotation. And then finally, got our middle trapezius. Those come pretty horizontal there, and those are going to help with retraction for bringing those shoulder blades together. Next one. Again, we're looking at a back view. Levator scapulae. Again, the name should give it away. Levator, think elevator, going up. Scapula, talking about the scapula. So scapula is moving up. Okay. So levator scapulae is going to help with scapular elevation. It's going to pull up on that sucker. In addition, notice the way these fibers pull. At this superior angle, it's going to pull it this way. Or actually, no, it's going to pull it this way. I apologize. It's going to pull it this way. So that's going to help with downward rotation. So these are going to pull up more here. Okay, so it's going to pull like this. So it brings it up, but it also tips it over. Kind of like if you had a glass of water. Okay, pulling up on it, you might tip it if you don't hold on to it tight. So it's going to also help with downward rotation. So elevation, bringing the whole scapula up, but then it's going to twist it as it comes up and help with downward rotation. This one you will need to know origins and insertions for. Origin, on C1 through C4, the transverse processes. So your first four vertical cervical vertebrae is going to originate at those transverse processes. And it's going to insert at the vertebral border, or the medial border of your scapula, above the spine. So here's the medial border, or a vertebral border. Above the spine of our scapula, that's where it inserts. Next two, rhomboid major and minor. Again, thinking geometry here. Rhomboid is a four-sided shape in math there. And these ones are directly from the vertebrae here, directly across from that vertebral border. Yes, you will not need to know origin and insertions for this. So just actions. So noticing, because the fibers move this way, it's going to help with retraction, help with bringing those shoulder blades together. But also, because they come at an angle here, they're coming up, it's going to pull like this. So we're also going to get some downward rotation to the scapula here. It's both retraction and downward rotation. The only difference between major and minor is the size of it. So major is a lot bigger, minor is smaller. Now let's move to the front side. Front side. Pectoralis minor. Pectoralis minor. In the next section, we're going to talk about the pectoralis major, which most people think of when they hear about the chest muscle. That's the big one that's on top. But the pectoralis minor is below. It's still on your chest, but it's underneath. It's deeper compared to the pectoralis major. And this one, you will need to know origin and insertions. It originates at ribs 3 through 5, close to your costal cartilages. So it originates there, but it comes all the way up and inserts at the coracoid process of your scapula. So again, you got your scapula here. This is an anterior view. Okay, it's going to insert right there. It's going to come across and originate on your ribs. So if this is coming forward here, we're automatically thinking protraction. It's going to pull the scapula forward. So that's helping with protraction. In addition, it helps with downward rotation. Okay, so we're taking our scapula here. Okay, it's going to pull forward. It's going to twist it down. So we got some downward rotation as well with it. And then because those fibers are coming here, is pulling down, it also is with depression. So bringing the scapula down. So all three of those actions that the pectoralis minor helps with. So again, no origins and insertions for this. Last one, serratus anterior. The name, serratus, thinking saw. Notice how it's very pointed here, the serratus anterior. So we're thinking a saw, sharp pointy parts of a saw. Anterior means it's towards the front. Now this is an interesting one to take a look at because this muscle, its origin, is going to be on those first 9 ribs. Its insertion, it's going to go underneath the scapula. It's going to insert at the vertebral border. So do need to know origins and insertions. First 9 ribs, here's the origin. Comes underneath the scapula and inserts on the vertebral border. So let's take a look at this picture. Will make it make a little bit more sense. So So notice right here. Again, we got our first 9 ribs for origin. Insertion, this is the medial border, the vertebral border there. And what that scapula does, it lies on top of the serratus anterior. So see how that works. Okay, so it's lying on top of the serratus anterior. As for actions, the scapula is going to come forward. So it's going to help with protraction of your scapula. Coming forward there, protraction. Squeezes it forward, protraction. If everybody's done push-ups and the next day they feel like their ribs here, okay, are kind of tender, that's because this raised anterior originates down here. So that's the muscle that feels tender if you've done push-ups or bench press, something along those lines. Now it also, notice it's helping with upward rotation. So serratus anterior also helps raise, tilt that scapula up. Upspring your arm above your head. So it helps with upward rotation of the scapula. On the cadavers today, we're going to be able to see the trapezius, and we're going to be able to see the rhomboid muscles. Now, I'm not going to ask you next week to specify which part of the trapezius we have, nor will I ask you to specify which part of the rhomboid on the cadaver. So you just say, if I got a pin sticking on it, just say trapezius. You don't just say upper, middle, or lower. Same thing with the rhomboids. Don't need to tell me major or minor on the cadaver. Just know, if I stick a pin in it, that it's one of those 2 rhomboid muscles. Again, these 3 here, make sure you got those starred some way. Those are the ones we need to know origins and insertions for. 12 here. Now we're talking about the muscles that move the shoulder joint, which specifically we're talking about is the glenohumeral joint. Remember, the glenohumeral joint is where the head of your humerus articulates with the glenoid cavity or the glenoid fossa of your scapula. So again, essentially, get your scapula here, get your humerus. Where they come together, that's the joint we're talking about. And so all these muscles are going to move the humerus all different directions. Not the scapula. These muscles do not move the scapula, they just move the humerus. So take a look at movements at the shoulder. Now that we're moving on to the appendicular skeleton, or your appendages, or your arms and your legs, remember with flexion and extension, flexion is always going to be coming up, extension is going down. So if I'm standing in that anatomical position, looking at my shoulder here, flexion is coming up. So this is shoulder flexion. Coming up, shoulder flexion. Extension is coming down. Extension coming down there. Remember, flexion and extension, they occur in the sagittal plane. Flexion coming up, extension of the shoulder coming down. We've got abduction going out, and then AD adding to the midline, coming back in. So abduction, abduction, coming together, we're going to be adduction, adduction. And this occurs in the frontal plane. Keeping abduction and adduction in mind, if we're looking from the top view of my head, sky view, bird's eye view, okay, coming out is going to be horizontal abduction. Coming together is going to be horizontal adduction. So that looks like standing here, horizontal abduction. Coming together is horizontal adduction. And these movements occur in the transverse plane. Last one, last two, we got internal and external rotation. Okay. So external rotation would be when the humerus twists out. Okay. So this would be external rotation. Start, finish. Okay. Even my elbow comes away from my side. Start, finish. I'm rotating the humerus out. External rotation. Start, finish. And what's happening is, if we take our bones here, here's my scapula, here's my humerus. External rotation, what's happening is the humerus is twisting out. So this action here, start, finish, is this. Start, finish. What my humerus is doing is it's twisting out. So that's going to be external rotation. Internal rotation is coming in, whether it's here, 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 twisting in. So that action again is going to look like this. Internal rotation. Intern. 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 Even if this elbow was straight, intern. Intern. Twisting in. Twisting in. Again, what's happening is your humerus here is twisting in, and that's going to be internal rotation. And that occurs in the transverse plane as well, because it's a twisting movement. If you turn your page, next page in your packet there, make sure you look at the top. It says shoulder joints. These are all the muscles that move make movements at your shoulder joint. So specifically, muscles that move your humerus. You can either look at it again in your notes there, grouped by action, or you can look at it here, and it's just a different way to take a look at it. Use both. First three muscles, the deltoid muscles. Do not need to know origins and insertions for this one. But these are the muscles on the outside part of your shoulder. Okay? Very superficial. And you'll hear bodybuilders talk about developing these a lot. With your deltoid, okay, they all insert, okay, at that deltoid tuberosity. You will not need to know that for the quiz, okay, but notice how they all come together at the same point. But they fan out, okay, and attach at the anterior, middle, or posterior side of your shoulder. Looking just at the middle one, the one in green here. Notice the way the fibers are going to run, okay, directly on the outside. So the way they're moving, the only action this can help with is abduction. Bring it away from the body. Anterior and posterior, red and blue, they're going to do the opposite actions of each other. Each of them are going to do 3. And again, based off where they are situated, these should make sense. Red, if you notice, is in front. Okay. So that's going to help with internal rotation. So bring it in. It's going to help with horizontal adduction, adding to the midline. And the third one, so it attaches here and here. Notice those fibers are coming up a little bit. So it's also going to help with flexion. So the internal rotation, horizontal adduction, those make sense. But it also, because they run up and down as well, it's going to help with flexion. Posterior deltoids, they're going to do the exact opposite. So horizontal abduction, external rotation, and since they're on the back side, they're going to also help with extension. So again, red and blue, they are exact opposites of one another. So if you know 3, okay, you automatically know the other 3 actions. Pectoralis major, okay? Big old chest muscle. Big old chest muscle. This is the one that we see. This is the one bodybuilders talk about a lot. You will need to know origin and insertions for this. I'm not going to get super picky to tell me which one the clavicular head goes to, which one the sternal head goes to. Just know that we got a few different origins and insertions. So if you look here, the origin of our pectoralis major is going to be all the way up here, the medial portion of our clavicle. We've got our sternum and our upper 6 ribs. So those are the 3 different origins that we've got for our pectoralis major. Then those muscles come across and they insert at the bicipital groove on your humerus. So remember, between your greater and lesser tubercles, you have the bicipital groove. So that's going to be its insertion. And because this is on the front side, okay, and the way the muscles are moving, it should give us a very good idea of what action this muscle performs. So if I'm looking this here, they're coming across. I'm thinking internal rotation. I'm thinking horizontal AD, adding adduction. Because those muscle fibers come up, okay, it should help with flexion. But it has one additional action compared to the anterior deltoid. It also helps with straight up AD, adduction. So not only horizontal adduction, but also regular adduction. So again, the way the muscle fibers look, the way they're situated, should give you a general idea of at least most, if not all, of the actions that that muscle performs. But this one you can see on the cadaver, and you will need to know origin and insertions for this one. Coracobrachialis. This one you will not need to know origin and insertions for. But this one here, the name gives it away. Okay? Coraco meaning coracoid process. Brachialis, thinking brachial. Okay, brachial, which means your arm. So it attaches there on that coracoid process. It attaches also here, okay, on the middle portion of your humerus. Now, because it's on the inside, it's going to help bring the arm together to the side. So this is going to be adduction, adding it to the midline. In addition, since the fibers run up and down, it's also going to help with flexion, bringing that arm up. So flexion and adduction, adding it in. Next to biceps brachii and triceps brachii. Now, most of the time, people think about this muscle as making actions at the elbow, and they absolutely do. But we're just talking about the shoulder in this unit. Just talking about the shoulder. The name helps you understand where it's at. So brachii meaning, okay, talking about the arm. Biceps, bi meaning 2. So you'll notice we got 2 heads of our biceps. Triceps, we got 3. Tri meaning 3. It's important that you add brachii into it at the end, because we also have a biceps femoris. And the biceps femoris is on the femur. So make sure we put brachii with it. We just don't say biceps. Say biceps brachii. Be specific. Origins, okay, up top here. Again, I don't need you to specify whether it's the long head origin or the short head origin. But notice, okay, for the long head, it originates at the supraglenoid tubercle. So if you got your glenoid cavity, okay, the tubercle directly above, okay, That's where the long head originates. The short head is at the coracoid process. They both insert all the way down here, okay, that radial tubercle. So I apologize, radial tuberosity. Radial tuberosity here, not tubercle, tuberosity. So they all come down, they insert at that radial tuberosity. Now, again, this unit here, we're just focused what's happening at the shoulder. So the shoulder here, because it's in front, it's on the front side, this is going to help with shoulder flexion. Help bring it up. Triceps brachii, that's on the back. It's on the posterior side. We got 3 different heads on this. The long head, in blue here, that's going to originate at the infraglenoid tubercle. So again, we got our glenoid cavity, okay, right below. That's our infraglenoid tubercle. That's where it originates. Lateral head originates at the proximal posterior part of the humerus. Medial head is going to be further down, so it originates at the distal part of the humerus. Up here, so notice this is more superior, okay, or more proximal. Okay. This is more distal. But they all insert all the way down here at the olecranon process. Remember the olecranon process, that's the pointy part of your elbow. We'll need to know origin and insertions for this. But just at the shoulder, this is going to help with shoulder extension. Bringing it down. Latissimus dorsi. Dorsi meaning dorsal. It means it's in the back. Latissimus. And this is another big muscle that bodybuilders talk about. If you've ever heard them talk about like these bat wings, okay? What will happen is a lot of times bodybuilders will go like this. And this big old honking muscle, okay, you can grab it there on the side, that's your latissimus dorsi. It is arguably one of the biggest back muscles that you've got. The origins, we're not going to get very specific with. Okay? Just understand it's lower vertebrae. We don't need to know specifically which ones. Notice we got our lower vertebrae, okay? Your lower ribs, and the iliac crest. The iliac crest is this upper part, okay, of your pelvic bones. So 3 different spots where it originates. But then it comes down through your armpits. Okay, so it's coming through my armpit here, and it's going to insert at that bicipital groove in front. And that's going to be important when we talk about a few of the different actions. But it's coming through your armpits, wraps around here. So if it's in the back there, most of the actions we should be familiar with. It's going to help with adduction, adding it in. It's going to help with flexion, coming back. Bless you. Oh, sorry, I apologize. This is extension. Sorry. Extension coming back. But since it wraps around here, okay, when it pulls, it's going to pull your shoulder in. So it also helps with internal rotation. So extension, adduction, and internal rotation. And again, no origin and insertions for your latissimus dorsi. Last 5. These last 5 muscles are very small muscles, okay? And they are all at your shoulder blade here, okay? And they attach on the upper portion of your humerus. Now 4 of these are going to be very important. Rotator cuff muscles. Any kind of throwing sport is going to use these muscles a lot. You'll talk about rotator cuff exercises. You want to keep these healthy. So these 4 are the 4 rotator cuff muscles. Make sure you make a note of that. These are the 4 rotator cuff muscles. The one oddball, which is not around the proximal portion of your humerus, it's down a little bit further, that's your teres major in yellow. So the teres major is the one lone muscle of these 5 that is not a part of your rotator cuff. It is not a part there. You do not need to know origins and insertions for the teres major. But understand, it's going to attach at the inferior angle of your scapula, so down here at the point, and it's going to wrap around just like latissimus dorsi. It's going to wrap around to the front of the humerus. So it's going to provide the exact same actions as the latissimus dorsi. It's going to help with extension, help with adduction. It's going to help with internal rotation. However, we got one more action teres major helps with, and that's going to be horizontal abduction. So it's going to help with horizontal abduction. So that's the one oddball there, teres major. One oddball. Now the rest of the 4, these are all the 4 rotator cuff muscles. And it's kind of hard to see how they are situated. I think this picture over here does a little bit better job, so feel free to take a picture of this if you would like. But you've got your subscapularis in the front. Nose is pointing forward. So subscapularis is in the front. And then we got the supraspinatus, which is on top. And then 2 in the back, the infraspinatus and teres minor. And essentially, all 4 of these muscles kind of create this circle around the head of your humerus. And that's part of your rotator cuff. Cuffing it here. Essentially, what the muscles do, if this is the head of my humerus, they come around like a squid, trying to help keep that humerus there in the glenoid cavity. Keep it all together. You will need to know the origins and insertions for all 4 of these. So that's why I think this picture here is going to help make a lot more sense. So let's take a look. What are the similarities? The origins for the supraspinatus, infraspinatus, and teres minor are all on the greater tubercle. So the teres minor, infraspinatus, supraspinatus, they all insert at that greater tubercle. The vague tubercle here on your humerus. The subscapularis, notice that's in front, and our lesser tubercle is in front. So our subscapularis is going to insert at the lesser tubercle. So again, the 3 in the back, they insert at the greater tubercle. The one oddball in front, that's going to insert at the lesser tubercle. Origins, fortunately, these 3 tell you exactly where they originate from. We'll start with the subscapularis. The origin for this muscle is going to be the subscapular fossa. Subscapularis, subscapular fossa. Supraspinatus is going to originate at the supraspinous fossa. The supraspinous fossa, which we talked about a couple of weeks ago. Below the infraspinous fossa, that's the origin for the infraspinatus. So these 3 here, these tell you exactly where the origin is going to be at. Teres minor, that's one oddball here. That's going to be the upper 2/3 of the axillary border. So this is an anterior view. Remember, axillary border means closer to your arm. So the teres minor, okay, is going to originate here, the upper 2/3 of that axillary border. Let's start with the subscapularis. Notice here, it's on the underside of your scapula there, going all the way to the front, your lesser tubercle. So this is going to help with internal rotation. This muscle does internal rotation. Kind of like the latissimus dorsi. Internal rotation with the subscapularis. Let's move on to blue here, the supraspinatus. This is kind of like the middle deltoid coming across the top. Okay. So this is the only action that occurs here is going to be abduction. Supraspinatus, abduction. And then the infraspinatus and teres minor, these are very similar. Okay, they do have the exact same three actions. They're on the back side, so like the posterior deltoid, horizontal abduction, external rotation, and they help with extension. Any questions there with that? So these are going to be the 8 of the muscles and then move the shoulder joints that we're going to see on the cadavers, or those are origins and insertions. These ones are going to be the cadavers. See, these are cadaver muscles. Deltoid. Don't need to specify which of the 3 heads it's going to be at. Biceps brachii, we don't need to differentiate between the 2 heads, nor the triceps brachii. Don't need to differentiate between the 3 heads.